Hi and welcome back to part 2 of a 2-part series on removing a spike of nail from a toe. The first video showed the procedure in detail, so if you haven't seen that one, watch it first. In this second video, I will discuss and walk you through the procedure. Hi, I'm Stephen Thomas. I'm a podiatrist, which is a foot and ankle specialist, and I'm based in the Harley Street Medical District of Central London. Just before we get going, I make free videos to help as many people around the world as possible with foot and ankle care. If you would like to help me with my mission, please give this video a thumbs up, share it with anybody you think it may help, subscribe to the channel if you'd like to keep up to date, and if you have any comments or questions, pop them in the comments down below. I'll get back to you, and I may even make a video based on your question so that we can help many other people. So let's get to part 2 of the 2-part series. The video starts with the right big toenail. It's already been prepared and cleaned, and a local anaesthetic injection administered to the base of the toe on the lateral side. Local anaesthetic was used because this procedure would have been too painful to carry out without it. It was decided to just carry out a block on the lateral side because only the lateral side was affected, and it was to also save the patient with any unnecessary pain and injection on the medial side. An injection at the lateral side should make the lateral half of the toe numb. It doesn't always work. Sometimes there's some branches coming over. Luckily with this case, the affected area was completely numb. However, had it not worked, I would have either administered a bit more into the same area or maybe had to also do the other side as well. When you look at the toenail, you can see it's quite swollen at the end, the distal lateral aspect of the toe. The nail, you can see, has been trimmed down the side, and it looks like it's been trimmed quite well as it curves around this lateral corner. But there is a hidden spike driven into the toe. You'll see in the video, the spike does actually come up to about here, but all of that is hidden underneath under the skin where it's pierced inside the toe. Hence the swelling on this part and the increased reddening on this part of the toe. Once the area was numb, it was then cleaned one more time just before the procedure. It's always tricky to fully clean around the nail. They're classed as grade 4 wounds, which are the dirtiest classification of a wound. And also trying to clean this area before the anaesthetic's gone off can prove difficult because it's too painful to actually wipe. So after the anaesthetic was administered and it was proven to be numb, the toe was then quickly cleaned again just to make sure it was as clean as we could possibly get it before the procedure. The first task was to find the spike of nail that was driven inside the toe, so we don't always know what you're going to find until you start digging around. With this one, it came out quite nicely. You can see as I put the Black's file down the side and sort of eased it out, the big shard of nail came out. The end of the nail did break off, and there was a little stub of a spike remaining. The nail then was trimmed back with some nail cutters. So I trimmed down here, and the idea then was to trim down this part, make sure it was as smooth as possible. And then a Black's file was used to file the area and make it super smooth. I'm not sure whether you can see this on the video, but the idea is when you're filing to put the file in and then pull upwards like this. So you pull back towards the tip instead of pushing down as you go down, you're actually pushing back. Cutting it back in this fashion allows the wound to heal because the nail is there cut back behind where the wound is. There'll be no nail coming up and irritating the wound site. Secondly, the nail root is underneath this part of the skin. It's like a thin jelly strip underneath here, and the nail grows in this direction. So as the nail grows out in this direction, if that is nice and curved, as that grows out, the curved angle there should not affect any of the skin up here. By the time that nail reaches where the wound site is, that wound site should be nice and healed up. The smooth edge of nail should just glide along the side of the toe and not cause any more problems. If there was any recurring problems, then you can always have another repeat procedure like this, or you may even consider having a partial nail avulsion with or without phenolization. I discuss partial nail avulsion procedures in another video. Once the toe was filed nicely and smoothly, the toe and the area then was flushed out with some sterile saline solution. And saline solution is basically a sterile salty water. And finally, nice dressing was popped on at the end. Well, I hope you found that video useful. If you did, please give this video a thumbs up, share it with anyone you think it may help. Subscribe if you'd like to keep up to date with all my content, and pop any comments down below. I'll get back to you, and if you have a good question, I may even make a video based on your question so that we can help many other people. Thank you very much.